And hospitalizations are also on the rise here in the Coachella Valley. The last time we checked in with Eisenhower Health 2 weeks ago, there were about 15 patients there with coronavirus. But now that number is nearly tripled. I spoke today with the Chief Medical Officer, Dr. Alan Williamson. Dr. Williamson, as always, it's great to see you. Thanks for joining us.
Thank you for having me again, Peter.
Things have certainly changed dramatically since the last time we spoke. What's the latest at Eisenhower?
Yes, unfortunately, we are seeing a very significant uptick in the number of cases here in the hospital. I think the last time we spoke, we were still averaging only about 15 cases a day in the hospital. Today, we have 42 patients in the hospital. So really heading up very sharply from where we were just 2 weeks ago. And looking at the trajectory, looking at the curves, looking at the positivity rate, all the other factors that we look at to try to predict where we're headed, it all looks unfortunately very similar to what we saw after Memorial Day, where we eventually headed up to our peak of over 90 patients in the hospital. So unfortunately, we anticipate a similar event occurring. The timing is the only question. Exactly how quickly we will get there is still a little unclear, but in all likelihood within the next month we'll be seeing a very high number of cases in the hospital.
How close is the hospital to hitting its strain and reaching capacity?
Right at the moment, we are doing okay. We have once again dusted off our surge plan to understand exactly how we're going to try to deal with this. I think the concern we have this time is twofold. First, it is occurring at a time where we normally get very busy in the hospital anyway. This is now, we're heading into our winter season. We have our winter residents that are coming back into the valley. And typically the hospital gets quite busy from January through April or May. And this is now going to be on top of that. So the last time we had our big surge was right in the middle of the summer, where we at least had fewer people in the valley, less business in the hospital in general. So we had, in that sense, a little bit more capacity, a little more space before we really hit the roof of our capacity. The second issue is obviously the holiday seasons coming around, Thanksgiving, and then Hanukkah, Christmas, etc. Times where traditionally people like to gather together. And we know that that is a recipe, unfortunately, for increased spread of the virus. So that is sort of the perfect storm that I think all of the experts have been cautioning against, that the last place we wanted to be was to head into the holiday season in the middle of a surge. And unfortunately, that's precisely where we are.
If you could put this in perspective for us, Dr. Williamson, how does this current hospitalization rate compare to the pandemic timeline as a whole?
So we're really seeing right now one of the steepest rises. The rate of rise of the cases is as steep as we have seen so far, even steeper than it was after Memorial Day. So again, it really has us very concerned. And also the fact that this is now truly a pandemic in the United States, meaning it's really affecting all areas of the US at a similar time. So the very first waves we were seeing were more sporadic, high concentration areas like New York City, et cetera, Seattle, large urban areas. But now if you look at the map, we see huge swaths of the center of the country, largely rural areas that are just being completely overwhelmed with the number of cases they're seeing. And then again, our winter residents, many of them are coming from a lot of those areas. They're coming from the East Coast, they're coming from the Midwest, they're coming from the Northwest, and traveling here to be with us in the winter months. So we're concerned about some of those people importing cases from outside to the valley as well.